Hello, everyone. Yeah. Welcome to the next hot topic, gut health with Dr. Patel. My name is Josephine Atluri. I am the host of the podcast Responding to Life, Talking Health, Fertility, and Parenthood. I'm the author of 2 books, Mindfulness Journal for Parents and 5-Minute Mindfulness for Pregnancy. I'm a certified life and wellness coach, and I am the mother to 7 kids. And I'm super excited. Yes, girl. Yes. I am super excited to be interviewing the incredible Dr. Patel. She is a board certified gastroenterologist. She specializes in IBS, swallowing, and anorectal disorders. She is also a speaker on gut health, mental health, empowerment, and women's health. And I would love for her to share a little bit more about herself and what propelled her to come speak with us all today.
Thank you so much. How's everyone doing? Woo! Is everyone having a great time? Okay. This is my second time being a speaker, and I'm so pumped because this is one of my favorite topics to talk about gut health and mental health, because everything starts in your gut. All health starts in your gut. Mental health starts in your gut. So as a gastroenterologist, I would do it a disservice if I didn't talk about gut health as it relates to so much of the rest of your health. I am also an IVF warrior. I went through it twice. I went under postpartum depression. I'm a mom of 2. And working and dealing with all the everyday struggles of being a mom. So I'm right there with you. So here I am to be able to spread the things I know, to be able to connect with you guys on another level. So here we go. Let's do this.
Well, I'm super excited to get started and dig in. When I found out I was interviewing Dr. Patel, it was meant to be, because as a wellness coach, I'm always exploring the connection between our mind and our body. So with that, I'd love to hear about the link between our gut and our health.
Yeah. So, where do you think, the gut instinct or the gut intuition, where does that term come from? Or, when you think about, oh, I got butterflies in my stomach when I got nervous, right? Or I had a gut feeling that so-and-so wasn't really good, right? They're sus. That comes from the fact that mood and your instincts are very interrelated. Mood is made in the gut. And that's because the nerves in your gut, it's called the enteric nervous system, that actually communicates with your brain. That's called the central nervous system. And there's one big nerve that goes in between the two. It's called the vagus nerve, okay? And so the two are very intertwined. And what intertwines them is the bacteria in our gut. Believe it or not, the gut microbiome is so responsible for so much of what happens. So let's talk about it this way. We've got this gut bacteria, and we need it to help us with making mood. How is it going to do that? It's going to start helping us make something called neurotransmitters. So you hear about serotonin, dopamine, GABA. You hear about all these good mood hormones, but they're predominantly made in the gut, and they travel to the brain via the vagus nerve, and that's what sets it. Now, what happens? Why is it a two-way street? Because when you get stressed, when you feel anxious, when you get depressed, those can get depleted. Stress can actually trigger stress hormones like cortisol to be released into the gut. That can actually slow down or speed up the bowels. So therefore, the bacteria that's supposed to be there for a longer amount of time to ferment is not getting to stay there and not getting to produce its happy hormones. So the two are very interlinked. You get stressed, you get rid of a lot of your happy hormones. You don't have enough happy hormones, that worsens your stress and your anxiety and depression. Okay? Other things that stress does what we call leaky gut, right? That's like the favorite term on the internet. Everyone's looking it up, leaky gut. What does that mean? Leaky gut actually means intestinal permeability, okay? So when you have stress and you have stress hormones being actually given into your bloodstream, the actual cells in your intestine are no longer woven together very tightly. They start to come apart a little bit. They're called the tight junctions. And when they're not as tight, they can allow for bacteria to leak through. That is what is permeating. That's what's called leaky gut. And that permeation of bad bacteria is now leading for a higher amount of bad bacteria to sit in comparison to the good bacteria. Therefore, you have more inflammatory markers. So hence, autoimmune diseases can begin, insulin resistance can begin, depression can begin, obesity happens, right? And so we really need to take care of our gut in order to take care of our mental health and vice versa.
Wow. I mean, I love that. Thank you for putting it all together, because you're right. We hear all about these connections, but we don't understand how that happens. And so, talking a bit further about this, I'd love for you to explain what it would look like if you had a healthy gut. And if you don't, what are the signs and symptoms that it's not functioning optimally?
So the big thing that we talk about when your gut health is out of whack, or people are like, "Oh, I'm inflamed." What does that really mean, right? They're like, "Oh, I went to a doctor. I'm convinced I'm inflamed. I've eaten the wrong things." Well, there are subtle signs. It doesn't have to be some big disease. There are subtle signs that your gut microbiome is not at the appropriate balance for you. And a lot of that is because you may get bloating, diarrhea, constipation, pain. Pain is not supposed to be normal. Getting pain all of a sudden, let's say because let's say you're not having your period or you're not giving birth, but you're having random abdominal pain that has now persisted for weeks, and it's just in one specific area. And maybe it started after you lost your job, or you're about to undergo a divorce, and after whatever has happened, it has been more stressful. That can cause something called visceral hypersensitivity. Your nerves in your whole GI tract is on overdrive from the stress that it's been experiencing. That stress of undergoing the divorce, or stress of undergoing a fight or getting a new job, those things are life altering and microbiome altering. And so it's really important to figure out what your stressors are and how you can try to tackle those.
Stress. I'm so glad that you brought that up, because, as a wellness coach, I'm constantly talking about that. And when we're in the fight or flight system, a lot of people don't realize that all of these internal systems start to shut down, one of which is our digestive system. So everything that you're saying to me makes total sense. Another question that I would like to ask is about women specifically, and issues in the gut related to women that you hear more frequently.
Absolutely. So as a gastroenterologist, I have predominantly women. And if you look at the statistics, 63% of women have IBS in comparison to the rest. There's more women who have irritable bowel syndrome than they have other things, okay? And irritable bowel syndrome has now been defined by the GI societies as a disorder of gut-brain interaction. They've called it that now. They have come to terms with the fact that it's not just in your gut, but it's because there's a disordered interaction with how your brain is connecting with your gut and how your gut is connecting back with your brain. So the fact that that actually exists tells you that there's also associated things that are happening there. So if you look at IBS, it's an overarching term, because I hate when people come in, they're like, "Oh, I was diagnosed with IBS by some XYZ doctor." And I'm like, "Okay, so what are your symptoms?" "Well, I have bloating, I have constipation, or I have diarrhea, I have pain." All of those are overarching things that can be under IBS, but it's because there's some type of disorder. And that disorder can be because there's a change in the overall bacteria, good bacteria in your gut. There could be because there's more nerve hypersensitivity around the organs in your gut. It could be because there is intestinal permeability or leaky gut, right? And all those things can combine. Oftentimes, people who have IBS are more likely to have other symptoms and other diseases that they're prone to, like frequent UTIs. It's called interstitial cystitis, migraines or headaches, back pains, fibromyalgia, okay? All these things. There's actually a phenomenon called functional abdominal migraine. So people who have head migraines are actually more prone to getting abdominal migraines. Same nerves, same brain, same spinal cord, different part of the body, okay? So you're getting headaches, it's coming on all of a sudden and you feel like crap. Guess what? The same thing can happen in your gut. Comes on all of a sudden, same brain, same nerves, now it's in your gut. Bam, now you have a severe amount of abdominal pain. So where did it trigger from? That's for something for you to talk about with your doctor, whether it's something that came from a long time ago in your past that you've kind of swept under the rug, or something that's ongoing, like a daily stressor, your commute, whether it's your family, whether it's your job because you're just kind of bearing through it 9 to 5, or you're undergoing some big psychological thing like being postpartum. Those hormones will change so much of you. They are stressful. Lack of sleep, establishing a milk supply every 3 hours, that lack of sleep is stressful. And that can change your microbiome significantly.
I don't know about you, but I keep going, oh my God. And like, really? This has been really eye opening. I love for people when they attend these things to have actionable tips that they can walk away from and start to implement. So, Dr. Patel, I'd love for you to share your top tips for maintaining optimal gut health.
All right, so let's start with what you can do from the outside in, okay? Because gut health is not just based on what you eat. And a lot of it is, obviously. But the first things first, our bodies rely on being a part of the outside world and nature. So go outside for at least 20 minutes a day to get natural light. It doesn't have to be sunny Southern California sun. It can be a cloudy day in Southern California, but you need natural light. That natural light will actually trigger melanocytes to push out serotonin, that happy hormone, okay? 20 minutes. That's all you need. If you're going to do a phone call, you're going to do whatever, sit outside and do it. 20 minutes. That's first. Number 2, there's a new study that came out. 11 minutes of moderate to vigorous activity a day reduces your risk of death by 23%. I know there's all this literature out there about how you need to have at least 150 minutes of exercise per week in order to reduce heart disease, strokes, all those kinds of things. And yes, that is true. But a new study that just came out actually shows that even if you get just half of that, that's 11 minutes a day, you're actually going to make still some degree of difference in moderate to vigorous activity. So get your heart rate up. I know there's a ton of YouTube videos out there that you can put on for 11 minutes that you can do. Get a friend, go out and walk, get that exercise in, because aerobic exercise actually promotes the growth of a bacteria in our gut called bifidobacterium. Bifidobacterium, if you look at your probiotic capsules, ladies, bifidobacterium is the number one that's on there, okay? Bifidobacterium is what's responsible for making that neurotransmitter called serotonin. So if you're looking to get happy, move your body, get those bacteria to make that serotonin, okay? And number 3, feed that gut bacteria. And what are you going to feed it? Fiber. Okay, so there's 2 big kinds of fiber that's out there. There is soluble fiber and insoluble fiber. And I know people who've come to me, they're like, oh, I'm on a low FODMAP diet. I can't have fiber ever again. I can't eat broccoli or Brussels sprouts or any vegetable for that matter. And, now I can't figure out why I'm still bloated. Well, now you've got functional bloating because your brain is telling your gut to be extended, right? And on top of that, your gut bacteria are super unhappy, okay? So giving it fiber is going to help the bacteria in your gut break down, make its products so that it can start making that serotonin, that norepinephrine, that dopamine. Not only that, short chain fatty acids, that's the breakdown product of fiber. That is what actually triggers for you to feel full. So the new magic drug that's out there, Ozempic, the one that everyone in Hollywood is trying to get on, right? Everyone wants some Ozempic and some Wegovy shots, right? So that, the way it works, it's called GLP-1, okay? Glucagon-like peptide 1 analog. and that makes you feel full. So if you want to feel full naturally, because our bodies actually have that hormone naturally, you want your own bacteria to make short chain fatty acids to tell it to release that hormone. So voila, now you feel full. You're not just eating all day long. Same thing. There's another peptide called neuropeptide Y, which tells you, hey, we're full, no point to overeat. That is also released when you eat fiber. Same thing is done. Your brain is then told to release dopamine and serotonin when short chain fatty acids are available. And all of this comes from fiber. So if you get my drift, eat your fiber. Yeah, you're going to be a little bit bloated after Brussels sprouts. We all do. Those are fermentable sugars that are in the actual Brussels sprout themselves. It's not going to make you fat. It's going to make you fart. Okay? It's all right. Eat it because your gut is asking for it.
Love the tips. So I'm mentally making notes of all these things. So now I'm going to open it up. We have a few minutes left to anyone who has any questions for Dr. Patel. Wonderful.
Thank you, doctor. We were just sitting over here. I have a feminine care brand, so a lot of our clients have chronic UTIs, and we know there's correlation to the microbiome, but can you expand on that?
Yeah, so just like how you have a microbiome that's out of whack and you're getting irritable bowel syndrome, you're just like that. You're getting irritable larynx or irritable bladder, right? You've got the vaginal flora that you've got, or the flora that you've got in your urinary tract is now out of whack. A lot of the flora that's in your urinary tract has lactobacillus in it. People want to utilize douches and people want to utilize soaps and fragrant things because somehow they feel like if it looks like a flower, it's got to smell like a flower. No, it doesn't. It doesn't have to smell like a flower. And that can mess up the overall flora. That on top of having a lot of stress, the same principle occurs, okay? The brain and the spinal cord is attached to your bladder. And in periods of serious amount of stress, you're not supposed to pee or poop. Okay, so in high stress flight or fight responses, you're supposed to be getting rid of all the contents in your bowels and in your bladder. So the body's like, oh, let's just get rid of everything so that we can get ready to fight. Okay, so in people who've got a lot of UTIs, their bladder is constantly being told by their brain, oh, let's get rid of this pee. I know there's only like 5 drops in there. Let's just quickly get rid of it, so that we can be empty so we can fight. Same thing happens with people who got a lot of diarrhea and they go 10, 20 times a day. They're getting rid of only this much poop because their body's constantly trying to get rid of it. So for those people, it's about calming down the nerves in their, GU tract so that their nerves can calm down and stop the constant overdrive that's causing them to have the frequent UTIs.
Any other questions for Dr. Patel? No? Wonderful.
So I've dealt with candida off and on. I had it systemic like 12 years ago. So just, if you have any advice around candida, I would love to hear that.
So this is something that I get pretty often, even in clinic, right? People come in with stool tests that they spent, I don't even know how many hundreds of dollars. And they're like, but it's a 72-page report saying I've got candida in my gut. We all do, right? We all, and you know this. Candida is part of our normal flora. And yes, it can become at a higher abnormal level than not. And it can predispose some people to more bloating and other, uncomfortable GI symptoms. But do we give you an antifungal? No, because you need that overall amount of fungal organisms to function. Okay, we're supposed to have it as part of our normal flora. Wiping it out with a oral candida medication is probably not the best idea unless you've got candida in your esophagus, which is your food pipe, actual amounts of it in your rectum. It's not considered like high amounts of candida. When you're immunocompromised, let's say you've got cancer, you're on chemotherapy, and you're unable to protect your immune system, that is when you've got candida literally growing in a lot of different parts of your body. Okay. And so, and that's when it's hard. And so that does warrant to get treatment for, with an antifungal medication. And again, overdoing it can also become harmful as well, because you're also wiping out exactly the other flora as well. So it's a fine balance, right? To try to figure out what's going to restore the flora and what's going to harm it.
Oh, great. Well, thank you so much for sharing your expertise, Dr. Patel. Has been so enlightening. I encourage you to continue the conversation after this panel, and I'd love for you to share how they can follow along with you on social.
All right, so you can follow me on Instagram, dr.gut_motility. That's dr.gut_motility. You can find me by my name, which is Kumkum Patel, or you can visit my website, kumkumpatelmd.com. Thank you so much for listening.